afternoon, everyone. Thank you so much for joining us at the SCRMP Primer Student Leadership for a Healthier World. This is a truly special occasion, and at the first time ever, we are bringing together three incredible international student leaders from different corners of the globe to share how youth can shape the future of healthcare. I'm Madina Qadisai, and I'm the chairperson of SCRMP Afghanistan chapter, and I'm honored to moderate today's event. Before we begin, here's a quick look to our agenda. Next slide, please. Thank you. So this is our brief overview of today's agenda. We will have a brief introduction of SCRMP, and we will have a welcoming discussion of our panelists. We will start our panel discussion and then closing reflection and summary. And then we will have some times for our audience to ask their questions. And lastly, we will have a thank you and wrap up. So next slide, please. Let me now introduce the organization body behind today's event, the Society of Clinical Research and Medical Professionals. The Society of Clinical Research and Medical Professionals, SCRMP, registered under the Lung Society's registered ACT 2001 registration number 417 of 2024, recognized by NITI AOH NGO DARP and IDTS 2024-046-2187, India, and officially registered under the State of Mexico, USA, an international society dedicated to advancing clinical research and supporting healthcare professionals. Our mission is to foster innovation, education, and collaboration in clinical research, ensuring medical professionals have the knowledge and tools to enhance patient care through workshops, seminars, and initiatives. We aim to contribute to global health and the life science industry. Next slide, please.
Medina John, for me, I can't see the slides. I don't know if it's the same for all the guests or no.
I think others have the slides. Okay, our first panelist is Diana Jo Longlen. Diana Longlen is a third-year pharmacy student at the Northeast Ohio Medical University with a deep passion for infectious disease, clinical pharmacy, and public health. With a strong background in business analytics and healthcare management, she brings strategic insight in her leadership and advocacy work. She currently serves as president of Northeast Ohio Medical University Infectious Disease and Trust Group, Regional Project Officer of IPSF Pan American Regional Office, Member at Large American College of Clinical Pharmacy, Vice President, Career and Leadership Development, ASHP, Pharmacy Student Forum. In 2024, Diana represented the International Pharmaceutical Students Federation as a delegate to the 78th World Health Assembly in Geneva. Contributing to global policy discussions on AMR, NCDs, and health system, she will continue this work at the UN High-Level Political Forum on Sustainable Development in New York City this year. Her pharmacy experience spans institutions like St. Jude Children's Hospital, Cleveland Clinic, and international externship in South Korea, where she supported infectious disease care and global pharmaceutical practice. Happy to have her today with us. Our second panelist was Mr. Gava, and I have to acknowledge our colleagues and everybody today in this meeting that Mr. Gava was unfortunately unable to join us today due to some unforeseen circumstances. He has sent his warm regards and best wishes for success of this session, and we look forward to engaging with him in our future SCRMP events. So for now, our second panelist is Josephine Mama East Daisy, who's a Doctor of Pharmacy student at the University of Ghana, entering her final clinical year. She's a passionate student, leader, and advocate with significant impact of both national and international levels. She has served as Student Exchange Officer of Pharmaceutical Students Federation of Ghana, IPSF Clinical Skill Coordinator, Deputy International Relations Officer, and also her dedication earned her multiple awards, including Best SEO of the Year of the African Region 2023 until 2024. Josephine has represented students on global platforms such as the World Health Summit in Berlin and the 77th World Health Assembly in Geneva 2025, where she delivered official statements on non-communicable diseases and medicine safety. She's also conducting research on social prescriptions as a holistic approach to patient care in Accra, Ghana. Her journey reflects leadership, advocacy, and a commitment to strengthening pharmacy education and global health. Happy to have her today for discussion with us. And our third panelist, Marisa El Haji. She is a pharmacist from the Lebanese American University, currently pursuing a PhD in drug design at the University of Sao Paulo, Brazil. Sorry. She combines a strong research background with leadership in global pharmacy and healthcare access. She currently serves as chairperson of IPSF Pan American Regional Office 2024 until 2025, founder of Mariam Foundation, improving access to medicines in Lebanon, founder of Kana MedPlus, consulting company for medicinal cannabis research and access, and in 2025, she was selected as a UN Youth Delegate, contributing to youth representation in global health and sustainable development discussions. Through her academic research, nonprofit work, and entrepreneurial ventures, Marisa is dedicated to advancing pharmaceutical innovation, health equality, and global health diplomacy. Happy to have her today with us. Welcome. So going ahead, before we start our official discussion, I would like to kindly invite Professor Ms. Nazifa Fakhriar, the organizational secretary behind today's event, to deliver her introductory speech. Ms. Nazifa has played a key role in making this program possible, and we are honored to have her today with us. Ms. Nazifa, are you there?
Yeah, thank you so much, Medina John. Good evening, distinguished guests, respected panelists, and dear colleague. It's my great honor to welcome you all to this premier forum of the Society of Clinical Research and Medical Professionals. Today we gather under the theme Today's Youth, Tomorrow's Health Leaders. This program has been designed with a clear purpose to empower young professionals in pharmacy, public health, and clinical research by creating a global platform for student leaders. Through our discussion today, we aim to highlight the vital role of youth in shaping healthier and more equitable communities, exchange innovative ideas and leadership experiences across different regions, build bridges between science, policy, and practice, and most importantly, inspire students to take an active role in advancing global health and patient care. This international premiere is not just an event, it's the beginning of a movement. A movement that unites passionate students leaders from across the globe to explore how young minds can contribute to a healthier future guided by knowledge, innovation, and collaboration. On behalf of SCRMP, I warmly welcome our distinguished panelists, Diana Jo Laughlin, Josephine Yost Dizi, and Marisa Al-Haji. I hope I pronounced your name correctly, and please forgive me if I did not. We are truly honored to have you with us today. I would also like to acknowledge our moderator, Ms. Medina Qazizai, chairperson of the SCRMP Afghanistan chapter, to graciously guiding today's session. With that, let us begin this exciting journey of ideas, inspiration, and leadership. Thank you, and once again, welcome to the SCRMP International Premiere.
Thank you so much, ma'am. Thank you so much for your inspiring talks. and happy to have you today with us. So before we begin, let's have a quick overview of objectives of today's program. As you can see, it's a simple yet powerful event to empower young professionals in pharmacy, public health, and clinical research by creating a global platform for student leaders. Through today's discussion, we aim to highlight the role of youth in shaping healthier and more equitable communities, exchange innovation ideas and leadership experience across different regions, inspire collaboration and build bridges between science, policy, and practice, and encourage students to take an active role in advancing global health and patient care. So without further ado, let's start today's discussion, and I would like to start the discussion with Diana. Welcome, Diana, and it's a pleasure to have you here. Let's begin with your insights. Are you ready?
Yeah, definitely.
That's amazing. So the first question is, how can pharmacy students take the lead in combating infectious disease and addressing antimicrobial resistance at both community and global level?
Yeah, so there's a lot of different ways you can go about this. So at a community level, I highly suggest just getting involved with your local chapters and your local public health departments and the systems and seeing what you guys can do just by like providing information, organizing awareness drives, or just even just having conversations with your family about how you need to take all their antibiotics when they're prescribed. Because we know everyone's like, oh, I feel better. Let's stop taking it. We don't want that to happen, right? At a global level, that's when it gets a little bit more intricate. And I know for a lot of youth, it's really hard to get to that global level. And I know I've been very fortunate to be able to attend and be a speaker, etc. Same with Marissa and same with Daisy. Just very fortunate with IPSF. But with that, it's just don't be afraid to reach out. Always say yes to yourself before someone tells you no. Always offer your help, always offer your insights, because we're all resources as students, because we're learning it right now. People that we're working with haven't learned it in a couple of years. So we gotta help with better web for them. So going to those global levels, it really amplifies our voice as youth. And then taking that leadership role in this is that taking the initiative in research, taking it in like an initiative in advocacy, and just taking that time outside of class to learn about what you're passionate about. Me, I do word like cross puzzles on infectious diseases, and I always test myself like, oh, like what microbe goes with what drug, and bugs and drug quizzes, because I think it's fun. So that's why I enjoy AMR so much. So if you are passionate about something in that level, go ahead and do that. And that makes you a steward in your own life. And then you can also just spread that knowledge globally and locally.
Yep. Thank you so much for highlighting important points about it. And I think the points that you have mentioned are, I think, the points that, as you mentioned, the puzzles come together and build the global momentum. Thank you so much for that. The next question is, having represented student pharmacists at the World Health Assembly, what strategies can student leaders use to ensure that pharmacy voices are heard in shaping public policies?
Yeah, I did attend the World Health Assembly with Marissa and with Daisy. That was a great experience. That was my first experience ever internationally working on policy. So it was really exciting for me because I've only done things locally. So to think about, I thought macro level was my state. I thought, oh yeah, like in my school teaches us that doing things at state level is more attainable than at a global level or a national level. So for me to go to the World Health Assembly was like, wait, I have to go and talk about this and talk to people who enjoy the conversation. So that was really exciting for me with the World Health Assembly. But you also have to remember that you can't be as frank with them. You have to be able to have those conversations and use the right verbiage to have the conversations. And when I talk about that, it's like that's more of like leveraging what you're doing. So like at the WHA, at the UN, and like even in your regional youth forums, you need to have kind of some notes on like a green paper and be able to know what you want to say and how to amplify, because you only get 2 minutes or less. So I could sit here and talk about AMR or NCDs for hours. And Marissa and Daisy heard me talk about everything, and then even health economics. So really having those notes ready to go and having that able to maximize that voice when you're at those global forums, that's a real great way to ensure that we're being heard. But also, it's not saying that this is easy. We, all three of us on this panel, have experienced pushback. Again, we gotta remember that like women's rights are human rights. A lot of us are having that conversation in 2 weeks at the UN, and we've all been told that, oh, you're not ready for that. Well, how do I get ready? Having those conversations is, they're kind of daunting. And again, it's getting that no, but I think having that perseverance to keep moving forward is what really kept us, a lot of us, not just us three, moving forward, making sure that pharmacy voices by the youth are being heard.
It's very insightful. Like, as you mentioned, representing the policy table, and the points that you mentioned were critical for, especially for policymakers and long-term impacts. So I think they're essential for students to take a note of those points, especially whenever they are in a forum with different peoples, and different peoples are sharing different kinds of insights about those tables. So that's amazing. With your background in clinical pharmacy, public health, and business analytics, how can student leaders best combine scientific expertise and leadership skills to build a healthier, more sustainable world?
Be honest, you make decisions without data? That's a real good question, because you gotta remember that there's multiple forms of data. You know, like what we see, what we hear, and our environment that we're in. So we're taking all that information in, and our brain is actually working that out to make us make the best decision in that scenario. But I think one of the biggest conversations that we had, for me at least, with the WHA and the UN, is that we need to get data aggregated and brought to the table. And I think that is one area where a lot of pharmacy students who love analytics and love informatics and knowing how drugs are being utilized with regulatory, how they're getting to patients, what that supply and demand data work is, I think that's a real area for us to really maximize our contribution on that level. Because who knows drugs better than pharmacy students and pharmacists? No one really. We care about getting it to our patients. And to think about it, a good, real life example right now is tariffs. So think about, we're paying, let's say London is paying a penny per metformin tablet. Well, with the tariff, they're now being asked to pay $1 per tablet. How do you think that impacts the market access to that patient? Is that state or country going to now start making their own metformin tablets? What's the quality on that? Is it the same quality that the company in India or in the same company as the US is making? How will that impact our patients' care? Will we have to find different methods, use clinical studies to find when we use another medication other than metformin, and then that leads to disruptions in care. So with the mindset, with policy and the world that it is now, I think it's really important that pharmacy students who can handle these kind of questions need to take a step up and take that leadership role, because patient care is being under scrutiny right now because of everything that, I'll say, my country that I live in is doing. And I really don't want to see that happen at a global level.
I think I love the point, especially regarding the data collection. And I think that's the base. So once we don't have the data, we can't proceed with that. And I think it makes sense with the points that you mentioned, and science gives that credibility. But leadership also gives us the platform to act. Combining the two of them with real life, it makes, I think, changes. And thank you so much for sharing those points, Diana. You have worked across local, national, and international roles. What challenges did you face stepping into leadership positions? And how can students overcome those barriers in leadership?
Oh, that's a good one too, because again, it goes back to persevering and staying resilient. I know those are two words that we hear a lot as students from our teachers, but it really goes back to a piece of advice I got at FIP, which is the International Pharmaceutical Federation. I met a work group leader, and she told me, you say yes to yourself before someone tells you no. Keep driving forward, keep pushing for what you believe is important and staying true to yourself and your own integrity. And I think that's what really pushes me forward is that it's my values I have as a person. I truly have a love for my integrity, to be honest, because I just keep pushing and I keep moving forward and I keep believing that there is a better world to be had and that people do deserve every benefit. They get to be whoever they want to be. They get to do whatever they want. I truly believe in that. So it's, for me, is that I was very fortunate to get leadership positions that I have at every level, and to have those experiences push me forward is very, very amazing, and I'm very thankful for them and very grateful for them. But as a student who's never done that, thinking back to what I did, is that I just asked. I just asked to be involved. And my local chapters, my local state, they were very open to having a student. They'd never had a student on the board before, and they let me do that. They let me, provide some information, and I just did a little bit of work for them here and there. And then it kind of turned into IPSF, and then IPSF gave me more of a platform to move forward with that and think about how I can promote things that I believe are very important for students to know at a regional level. And then being at WHA, they even gave me another option. I was assigned side events to go to, and then I was able to sit there and listen and broaden my own mindset on different perspectives. Like, I think one that I really loved was that making illegal drugs legal and making their work balance appropriate and safe. And I was like, oh, I never thought about that. Especially in pharmacy school, we're taught to never use cocaine. But what if we made it legal? What would that do to the workforce of that company that makes cocaine? So I think not being afraid to take that step and say yes to yourself and know that you are confident in what you can do and that you can level up in your own research skills, your own soft skills with talking, and utilizing your own background from pharmacy school.
I think that's incredibly amazing. Like, as you mentioned, leadership just don't need that point to step out of your comfort zone, but also needs that curiosity and hard work, precision, and collaboration that makes the journey possible. So yes, exactly. The points are incredibly amazing, and we need to follow all of them. That's wonderful. Thank you so much for that. And looking ahead, what role do you see pharmacy students playing in the next decade of global health, especially in area like pandemic, especially for the medical students and pharmacy students and health system resilience?
Again, with the U.S., like going back to my example I gave earlier, with market access concerns, I really believe that many regions and countries are going to start supporting themselves and creating different businesses. But I think it's also going to increase global competition. I think it's also going to take a hit on health economics, especially when it comes to drugs, when it comes to supply chain. I think there's a lot of scenarios that are going to cause a lot of delayed care, to be honest with that, because if you think about it, we're creating brand new systems in countries that have never had these systems before. They were because of what other countries are doing. Like India is one of the main producers of generic medications in the world. Okay, so thankfully that doesn't hurt other countries, but it hurts like the United States. It hurts other countries that may be impacting that, which will then create, okay, well, what is the US giving us? Okay, well, we need to recreate that product here now. So I think it's going to cause a lot of delays, and I think staying resilient as pharmacists and pharmacy students in that process is going to be very important to make sure that we think out of the box and think of other ways that are accessible to our patients and to ourselves And I know that it's causing a lot of opportunity problems for students who have to get visas and want to be at those conversations in the US. And I think that's a big conflict to be had too, is that the US is now blockading visas. So I think it's very, very great that the UN is moving one of their offices to Nairobi, which is a very accessible country for many people with different visas. And I know UN Women's are moving there, UNICEF is moving there. So I think we'll have a lot of great conferences there, which will allow for more student voices from other countries. I think that will help with that accessibility. And again, I feel bad saying it, but like just keep moving forward, just keep staying resilient and just thinking outside the box, because we can't use ChatGPT for everything. So we have to really think about what we can do and how we can keep getting medications for our patients and gain the best care for our patients.
Exactly. That was a powerful vision. Like, it shows that students are not just learning today, they're actually building tomorrow's healthcare system. So they need to rely on their own knowledge other than systems or AIs or electronic devices. So that was amazing. Thank you so much, Diana, for sharing those all amazing insights with us.
Thank you.
So moving ahead, as Marisa just texted, she wants to be the next panelist, so I would like to proceed with her. So are you ready, Marisa? Perfect.
Super ready.
Amazing. So let's proceed with the first question. And I use global health policies to accelerate progress toward a healthier world.
I'm sorry, can you repeat, because it's lagged in the first two, please?
No worries. As both a drug design researcher and a UN youth delegate,
Yes.
How can student leaders integrate scientific innovation and global health policy to accelerate progress toward a healthier world?
Thank you for your question. Actually, let's begin by saying that it's a pleasure and honor to be with you, and especially to share the stage with my IPSF colleagues, Youth and Diana. And actually, we have Gava with us in the meeting. I just saw. So I'm really happy to be here with you today and to be sharing the stage with them. So back to your question, basically, as to integrate a certain policy in global health, I believe, and it's a fact, that research is the cornerstone for any policy implementation. For example, I can give you the example of my field of interest, which is medicinal cannabis, which is now booming worldwide, not even in the market, but also in the research studies, that, as you can see in the literature, we have evidence. And usually to implement it in WHO, for example, you need evidence. And how you get this evidence is through research. So we need, of course, preclinical studies like in vitro, in vivo, study more about the plant, about the benefits of this certain, for example, plant and its effect on health, like different type of disease, not just, for example, cancer or inflammation, but also maybe epilepsy, diabetes. And these are research that are ongoing to integrate a certain framework policy, and to follow the international guidelines of WHO. So research and innovation is the cornerstone for any policy implementation. So definitely research is very important. Definitely we need researchers. This is why I need to give credits to researchers worldwide, because these people are the cornerstone and are the, if you want, the first line of any implementation of any policy in global health.
That's a perfect point. Thank you so much. And as you mentioned, innovation only becomes powerful when it's translated into policies and access, and researchers are doing that job. That's amazing. Thank you so much. Through the Mariam Foundation, you have helped patients access medicines free of charge. How can student leaders worldwide champions equitable access to essential medicines, especially in crisis-affected regions?
Thank you for your question. Thank you for giving credits to Mariam Foundation. It's very dear to my heart. So this NGO, just to give an overview about it. Like I come from Lebanon. Like I'm half Lebanese, half Brazilian. I moved to Brazil. It's been like I will do 3 years. So I wanted to do something for my country, and especially this affected area of many wars that we are also always in the middle because of the geography location. So we are always affected. And so I wanted to do something for my own people. This is where we started an idea, me and a group of pharmacy students and pharmacists. We are colleagues, not even friends. Some people I met online. And I started online, to reach out to people. And no, the funny thing, how like people reach out to me, and when they saw the forum online, they were interested to also join the force together and do something for our own people, for our own country. So this is where we started in February 2023. We started to reach out to Lebanese expats worldwide. We have a lot in Brazil, in Sao Paulo, for example. We have in Belgium, in Germany, in Dubai, in Emirates, in Egypt. So we joined our forces and we started to send medications at zero charge to the patients. So we had like a database of patients that's really in need of medications. And we started, and we are still helping. Especially we respond to crisis. Like last year, in November 20, and started in September 2024. Actually, 1 year ago, we had the war with Israel, and we responded to this crisis. We had the displaced people from the south getting their medications, because we directly respond to crisis for food and for clothes, for housing, and we forget about these people that have chronic disease and needs. They are in need of medication every day. So of course we joined the forces and we help, and we're still helping. So basically, like, back to your question, I believe that we need, as not like any people can, like anyone can be a leader, anyone can take this step. Like, as I mentioned, we directly gathered our forces. So you need to have like a humanitarian side of you, to have some empathy toward your people. You have this, some empathy toward, like, if there are really people in need, we need to help them, without any interest, without any personal interest. So this is what happened with Mariam Foundation. We joined our forces, and you need to have this humanitarian side, of course, and you need to be resilient. Like, many months passed, and I think always like, how can I get, like, the stock will get empty like few days later. How can I get other donation? And I believe like God also is helping, because we're doing something humanitarian. Like, directly we do a collaboration, for example, with Rotaract Club, or for example, people start to send medications, because we don't take money. Either we take money, we directly send to pharmacies to buy the medication, or we directly take medications. So the donations just appear, because we are doing something not for personal interest. We are helping these people. So definitely humanitarian side is requested, is required. And the being resilient and keep going, like keep pushing. No, I want to keep helping. For example, no, I don't give up, for example, because the stock will be empty. No, I start to find other collaborators, other people, I reaching out. I believe like these two traits can help in the humanitarian sector of pharmacy.
That's
Thank
very
you.
inspiring. It just made me speechless. It needs also courage, resilience, as you mentioned, and also that confidence to like start a work like that. It needs a very big courage for a person to start it.
Yeah, and just to let you know that this NGO started without registering it. Like, we started, by people reaching out to us like online, and we formed the group directly. Like, couple of days, I remember 2-3 days, we had the team completed with coordinators and team members, and now that is registered. We started without registering it. Just believing in the mission, people believing in our mission and trusting us that this NGO is not biased, this NGO is not taking any personal interest, it's just helping these people in need.
That's amazing, super inspiring, and congratulations for registering your NGO. Well, at this response, you already showed that leadership is not about the title. You need to have that humor,
Definitely.
that empathy, that feeling of helping people and impacting people's lives directly in a positive way.
Yes, and being humble, like it's not about any position, you know, any like a good leader, I believe that you inspire others, not just being a boss and you want to lead this way. No, you need to inspire others to also for them to have like opportunity also to lead, because we learn from each other, you know, and people who make you a leader are trusting you to be a leader, you know, and yeah, that's it.
That's amazing. Okay. Next question is, with your experience across IPSF, WHO, and entrepreneurial ventures, what skills should today's pharmacy and healthcare students develop to thrive as global leader in science, diplomacy, and health equality?
Thank you for your question. Maybe I would like to add on what already Diana mentioned. So basically, to be a leader and to enter this diplomacy sector or maybe entrepreneurship, you need to have, of course, a passion for it. You need to be passionate about what you're doing. In this way, you can reflect your passion to others. You can inspire others, and you can become a good leader and lead in a good way. But I believe like passion or talent are not enough. And passion combined with work, with hard work, this is where you can succeed. Like anyone can be a leader. Anyone can enter diplomacy sector. Anyone can be a businesswoman or businessman. To have a vision combined with a passion, you need to love what you're doing. And at the same time, work for it. This is where you can succeed in any sector, whether in global health, in policy sector, in research sector, in humanitarian sector. Because as we know, like as pharmacy students, for example, like pharmacy, our field is very broad. And people can go into community humanitarian, can go to hospital or clinic, can go to research. There is no sector better than the other. You need to have like a passion for what you want, for what you're doing, combined with hard work, and definitely anyone can succeed in any sectors that they want to pursue later.
Exactly. That's I think an excellent insight about it. It's a kind of combination of technical knowledge and diplomacy, advocacy, and your talent and hard work that needs
exactly the will you do, the will of doing, you know, the will of doing combined with hard work. This is where anyone can succeed.
Yeah, the formula of succeed.
Yes.
Thank you so much. As someone who founded both a nonprofit and a startup, how can students balance social impact and innovation in their career?
It's a very good question, actually. As a startup, because we are still starting it and we are in the process of registering it, I'm passionate about what I'm doing. Like I'm a medicinal cannabis advocate. You know, I advocate for the benefits of this plant. Like I believe, because the startup is about medicinal cannabis. So I believe like this plant should be free, but controlled definitely, because we have many controllable substances like morphine, for example, like opioid. Why these medications are in the pharmacy controlled, but cannabis cannot be controlled in the pharmacy, you know? So I'm very passionate about this idea of making it free to people, to have access to the patients, actually, because again, I'm in this sector and I have more than 8 papers in very prestigious journals, high impact factor. Many of them are in Nature and Sciences, in the Scientific Report, for example. So we have evidence like this plant is beneficial for cancer, for inflammation, for epilepsy, for nephrotoxicity, for diabetes. You know, like I worked in research, so I believe like passion combined with research and the evidence that I got from my own hands, you know, in preclinical studies. I'm talking about in vitro and in vivo studies. These two things combined made me think about a new startup to counsel about this plant, to see, and especially because I'm seeing a good market, you know, like we are seeing a global market that will reach in 2030 more than $100 billion. I'm talking globally. So I'm seeing the movement in Brazil that is toward legalization, fully legalization in Brazil. I'm seeing in Germany that was legalized in 2024. I'm seeing in USA it is legalized more than 20 states. We're seeing in France also the movement toward legalization, fully legalization. You know, in many countries, in Morocco, in Lebanon. In Lebanon, we are legalizing it since 2020, and now we formed the authority of council committee to give license to company and start, you know, producing medications based on cannabis products. So basically, like seeing the market with the passion that I have and the evidence that I got through research made me do a startup to counsel about this plant, you know, not market, just it's not about marketing, but about really give the knowledge needed to people that had maybe some misconception about this plant or doesn't know anything about this plant, you know. So I believe, like, back to your questions, like humanitarian passion combined with knowledge and evidence made you what you really want, you know, make your idea more clear to you and make anyone passionate about what they want to do, and maybe start a startup through the ideas that they believe.
That's, I think, a very motivation thing. And I think that from your answer, it shows that the business and compassion don't have the opposite ways. They can be partners together to make a positive change.
Exactly. But everything's through a controllable way and having evidence, like not, for example, talk about any topic, but without evidence, you know. Anything need to be realistic and combined with the passion that you have, and everyone can succeed.
That's amazing. So the last question, looking to the future, what role do you see young professionals playing today in the integration of emerging technologies, for example, like AI, digital health, and biotechnology into global healthcare system?
Very good question. So I believe it's not AI is not the future, it's the present. And this is where once I finalized a pharmacy school and I said I want to, because my work was, I was volunteering in a lab. We worked just bench work, you know, in vitro with cells and in vivo with mice or rats. So I wanted to enter a totally new field to me, which is AI, because I believe like AI is the present and everything now is relying to AI, especially in pharma. Like I'm talking specifically on pharma. Like having doing research in AI is very rewarding for professionals, for young professionals, because you don't only learn how to the skills or the techniques, laboratory techniques in silico studies or computational studies, but also you get to know that okay, we can discover a new medication in a very fast way, because you can do a virtual screen. You can screen a huge database, like I'm talking about more than 13 million, and through the triage of computational, you get selected only two compounds to test in vitro. So this is time effective, cost effective, and effort effective as well. You know, you can save time and you can save effort by computational work, which is AI, and discover new medication, maybe find a medication that is still available, that is available in the market for a certain disease. We call it repurposing, and find other therapeutic effects. You know, this is all through computational. This is where innovation is happening through AI, but we need to get to know how to use AI in the research I'm talking. And yeah, basically this is the present. This is not the future of medicine, it's the present of medicine. And now all pharma companies are relying for computational work to discover new medications, make more money in a very cost-effective way.
Well, I think that was a very thought-provoking answer. It highlights that students should be ready to adapt and lead to the rapidly evolving healthcare system that's going to grow very rapidly. So that's amazing. Thank you so much for sharing that. I really appreciate your answers.
I should thank you. Thank you so much for having me.
Thank you so much. So going ahead, I will be looking forward to go ahead with Josephine. Delighted to have you with us.
Hello, thank you. It's an honor to be here to share what I know.
Thank you so much. So let's start the discussion. I will have the first question. Having led international SEP collaborations and represented students at the World Health Assembly, how can exchange programs strengthen student leadership in building a healthier, interconnected world?
Okay, so first of all, I want us to know that student exchange is very important. It helps to make you the professional, or it helps make you the students holistic. You know, we are always thinking about making therapy holistic for our patients, but what about the professionals ourselves? So you also have to be holistic in all corners of life. Okay, so one way to be holistic is student exchange. That's one of the easiest way you can get to know about different health systems across the world, even in your own country, your own local setting. Going to have healthcare knowledge from a different place, from your vicinity or from a different vicinity. It all comes together to form the student exchange I'm talking about. So, like basically, what is student exchange? Like moving from one place. You know, we have two types. I always say there's two types of student exchange. We have the physical one and we have the virtual one. What we're currently doing is a little form of virtual student exchange because I'm from a different country, the other panelists are from different countries, and at the end of the day, we are sharing health knowledge. We are sharing knowledge on health and knowledge on what we know from different areas and from different aspects in life. So then there's all forms of student exchange. It helps you, the student or upcoming professionals, to know what we have to know. It helps you to understand basic or pre-advanced knowledge on different healthcare systems in different countries. For example, I moved from Ghana to Norway. I get to experience community pharmacy there, or hospital pharmacy, or industry, or any sector of pharmacy. And I get to understand how systems work. I get to adapt to their work. I get to understand their culture. It all helps. It's all part of the pharmacy we are learning because it helps us to get to understand people and be, as Marissa said, to have empathy for people. It all comes together. It's like it comes together. Everything is connected. So then when it comes to coming together to foster global health, student exchange is part of it. Because if I'm just in my corner, my vicinity, I go to school, I come back, I don't move anywhere to go and learn about health from different sectors, I don't get to appreciate what other people are going through. I don't get to understand or adapt to their changes. But the moment you're able to engage in student exchange, you're able to learn different areas and get to know why they do what they do. Also, in our countries, in our local setting, let me use countries, we have conditions that are peculiar to our countries. For example, when it comes to malaria, it's very endemic in Ghana. Like a Ghanaian cannot go without saying he or she has not had malaria. You surely have it once, but you see, we've built a very strong immunity against it, but we have identified that that's one of the conditions that is very prevalent here in Ghana. So then when you check our EML, that's our essential medicine list, you realize that anti-malarials are part of it. When you go to different countries, you also realize that everybody has unique conditions that is peculiar to them. So then they also have their own national EMLs, essential medicines list. So how would I know if I want to be the global professional in the future? How would I know, or how would I adapt to such? But by through travel, one, or as I said, it doesn't have to be travel, we are students. It's not all the time that we are very financially okay to be able to travel from one place to another. but you have to start small from somewhere. As I said, travel doesn't necessarily mean moving from your country to another country. Even moving from one locality to another, you were able to, that's a form of student exchange, I would say. You're able to learn what is happening at the different area. You're able to adapt, understand the people, their culture. It builds with adaptability, it builds with communication. Because look, for example, if you come to the capital of a country, maybe the way you communicate to your patients, like when we are doing our internships or attachments, it's different. When you come to the capital, they are more, let me use Ghana as an example. They are more literate in the capital. So then, people come into your pharmacy or come into where you're working and you can interact with them on a certain level. But when you move for example, the capital to, let's say, the village or a place that the literacy level is not that high, there's a way you must adapt to be able to communicate to them. And it's all part of the student exchange. If it wasn't student exchange, how would you be able to develop such a skill of adaptation, communication, and collaboration? Because look, sometimes you'll be, for example, depending on, in Ghana, there's sometimes the situation whereby you're supposed to be, after you're done with your set year rotation and you're supposed to be placed to do your housemanship, they can push you or place you anywhere in the country. When you go, maybe you don't understand their language very well. You have to collaborate with someone to be able to work together and understand the patient or the client in front of you. So student exchange really helps with getting to adapt easily, understand people easily, communicate easily, and lastly, collaborate easily. Okay, so that's what I'll say with the first question.
That's amazing. I think that's all an excellent reflection of that, especially regarding the points that you mentioned. They need to be holistic and also have physical and visual connection through a wide range of knowledge in case of sharing this knowledge with each other across borders. And also regarding things that you said, it's, I think, very necessary to exchange the programs, especially to connect cultures, build empathy, and create future leaders ready for future collaborations, I think. So thank you so much for that. And the next question is, from your work with the FDA Ghana and various clinical settings, what role do you see students for pharmacists playing in treatment begun globally?
Sorry, I only heard the part of the FDA Ghana. Can you reiterate the question again?
Sure. From your work with FDA Ghana and various clinical settings, what role do you see student pharmacists playing in ensuring safe medicines and strong public health systems in Africa and globally?
Okay. So, first of all, maybe one might not know what FDA is. FDA is Food and Drugs Authority, okay? So in Ghana, it's Food and Drugs Authority. That's what we call FDA. So they regulate the sales of food and medications in the country, okay? They are the ones who approve clinical trials and all that with respect to medication and all that in the country. So with my experience with the FDA, I got to appreciate a lot of things with respect to pharmacovigilance and also syndromic disease surveillance. I'll explain what that is. So when it comes to pharmacovigilance, which you get to appreciate when you have an internship at the FDA, you get to realize that everybody has a part. When I say everybody, I mean healthcare workers, pharmacists, as we are, and also medical doctors, professionals, medical professionals. You get to appreciate that it's very important in your line of work to ensure that you are really following up with medication therapy when you prescribe them to your patients or your clients. Why? Because when we are done with the preclinical trial, the clinical trials, when it gets to phase 4, what do? That's marketing and post surveillance and pharmacovigilance. That's where the medications that are sent out, we get to see the long-term effects. Okay. How do we get to see the long-term effects? That's where we pharmacists, we play a role in, because pharmacists, 3 things. Community pharmacies are like literally in the hearts of communities. Like, that's one. Secondly, I stand to be corrected elsewhere, but majorly, the first point of contact to healthcare service or system is the pharmacy. And thirdly, when it comes to patients to health worker engagement, I can, should I say proudly, I can majorly say that pharmacist to patient relationship or pharmacist to patient interactions is very high with respect to other healthcare workers. Because the moment, when I look at the space in Ghana and also the part I've gone to, the moment something is wrong, the closest facility can get around is a pharmacy. So then you go. So that shows that we pharmacists have very high or strong interactions with patients. So since we have very strong, we majorly interact with patients, then it means that we have to play a very important role when it comes to ensuring that they get the best medication therapy, or they understand what they are taking and why they are taking it. So then when a patient comes to you, I took this medication, I feel this, I feel that, you're supposed to understand why the person is feeling what he or she is feeling from the medications he or she is on or is taking. So then this goes back to what you have to do to yourself. Make sure you know your facts well, your medical facts, your medication facts. Make sure you know it very well, because that's what's going to help you behind the counter or at the pharmacy or any pharmaceutical related sector to be able to do what you do best. That's to ensure at the end of the day, the well-being of our patients is top priority. So then, if you know your facts well, your medications well, you know the adverse reactions and the enzyme reactions. Sometimes you're supposed to know whether the patient is GPEP. Like, you get to know all these things. When you're able to know them, then you understand why the patient is feeling what he or she is feeling at the pharmacy or at the hospital pharmacy or wherever. Okay, so you have to know your facts well. That's one very important thing. But one thing I always say to my people is that when you know your medication facts well, it gives you this confidence to be able to, say what you say, because you have strong backing. Like, you know what you are about. You know what it can be what you know can be what's the word? It can be confirmed from sources, pharmacopoeias and all that. So you should know your facts well. So when the patient comes, when you interact with your patients and all that, you're able to also identify a lot of things. One, because we interact with patients a lot, you're able to follow some trends. Okay, some trends. So this is where the syndromic disease surveillance comes in. Due to the dispensed to patient data, that is the medications that are being dispensed on a regular, as you are following. The pharmacist is one of the healthcare workers who can easily identify such if there's an upcoming syndrome, an upcoming disease in the community, because we're able to study what dispense to clients or dispense to patients medication data. You can see that people are always asking for, people are bringing prescriptions for a particular condition. You are able to identify it very quickly if only there is enough data collection. So going back to what Diana said, this is one of the spaces that data has to be collected when it comes to should I say prescribing, when it comes to dispensing medications. Okay, and also when you get the data, of course, don't gatekeep, share, because it helps the other person elsewhere to understand, as we are all coming together to achieve one global health or one health, they say. So then, how we students can help or can help with safe use of and rational use of medication is we have to ensure that we know our facts well. That's one very important thing. And secondly, when you get to the pharmacies or the healthcare sectors you are at, you have to make sure you really follow what your preceptors are saying or are doing, and also contribute. Get to understand what you have to understand, because at the end of the day, we are the next people to be at the space or at the counters to help our patients. So then, connecting the FDA experience I had, where I got to understand the importance of pharmacovigilance, and also connecting it to the fact that pharmacovigilance, where the patients come and report their side effects and their adverse reactions and all that. You submit all the data you collect to the FDA or to any regulatory body that is in charge of that. It helps you to be able to stay strong with respect to helping out with pharmacovigilance. And we, the students, pharmacists, or we students in medical field can help with that. Of course, we are learning, of course, we're not there yet, but we are on the pathway. So you have to put that in your mind, and when you get there, but you have to start now, you have to develop the habits. So when you go to the community pharmacy and you are having your trials and interacting with patients and all that, remember in your mind that you're supposed to ensure that You ask the patient certain questions about their medications they are on, how they are feeling. You have to be intentional when it comes to those things, because if you're not intentional, you can't help your patients. You have to be passionate about it as well, because you have to connect to the patient on a certain level, and it helps them to open up, establish a therapeutic relationship, open up, and be able to tell you their problems. And you can also collect your data. After collecting your data, you're able to help them with what they need. Do you understand? So that's basically what I would say on that question. Thank you.
Thank you so much. I think they were all very important points, especially about the points that you mentioned about the medication quality, and especially the students that are currently going to drift deep into this career and become the future pharmacists, specialist pharmacists in this area. They need to know about the facts of medication, and also how to know the patient, that how they may react, or they may know about the technical points about that, and take it as a responsibility for themselves. So thank you so much about that. The next question is, you have bridged diverse regions through cultural and professional exchanges. What lessons can be drawn from your experience to help student leaders transform cultural diversity into global health solutions?
Okay. So when it comes to the diversity aspect, I have moved from my local setting to the capital, to outside the country, to appreciate how healthcare systems are being run in different places. And I've gone to appreciate that you have to, in order for you to be the best you can be at a different place, you have to understand their cultural systems, their traditions, their beliefs. I mean, to a point, to be able to appreciate what they believe in, to help them at the end of the day. Because I can't move from my setting to a different setting with my my mindset and not ready to adapt or change when I get there. Because they also probably believe in different things. For example, let me just use classical examples. If I'm at a community, an Islamic community, there are certain rules with respect to pork that they don't, let me say, want in their medications and all that. If I'm moving to a community like that, I have to know about the community, the people, their traditions, their culture, and adapt my mind to it, so that when I get there, I'm able to deliver the best therapy I can. Because, for example, about the Islamic pork issue I just mentioned, that is something they believe in. They don't take pork or something. I mean, I'm taking my knowledge from what happens here in Ghana, okay, and what I've read. When you get there, because of that, whenever you're giving medication, you check the I forgot the leaflets in it, or you check the box. Then you can see whether it's pork free. I mean, it doesn't contain any gelatin or anything. That gelatin is a product of pork, so you have to you have to be very intentional, just so you are respecting their culture. When you do that, it helps them to know that, okay, this person is really concerned about me, the patient, and it helps them to easily take their medication and adhere to it. It's more like a placebo effect, kind of, because just you listening to them and accepting their culture helps them to also have the heart or have the right mindset to take their medications and all that. So one, it's important to brief yourself before getting to that community or wherever you are going to. And that's one thing about cultural diversity, because we are all different. But there's one thing we all want to achieve here, is giving our patients effective, high quality health, like good health therapy. Because that's the goal. That's the joy of we professionals. When our patients is improving, like well-being is improving, like holistically, psychologically, physically, like all the needs, let me say. So then that's one thing that would help. So you see, I don't want to just go to the global level. We have to start from like locally. When you start locally, it prepares your mind for bigger things. Why am I saying that? It's because when you are able to start small as student leaders, I mean, start small as professional students, that's when you're able to prepare for the bigger things. I mean, don't rush into things, just get to appreciate things small by small. And that will help you when it comes to the cultural diversity levels. Okay, with respect to getting to appreciate the people's culture, what they believe in, as that would help them with medication adherence. Okay, so that's, I don't know whether can you please reiterate the question so I know whether I've captured every part of the question?
Yes, you have captured it all very well. Thank you so much. I think
Thank
you have
you.
emphasized on all of the diversity, the points that are important for students, and that's amazing. So the next question is, having delivered statement at the World Health Assembly, what advice would you give to students who aspire to represent their peers on high-level international platforms?
This is very simple. I mean, I would just say be confident. One, I don't think you can't achieve certain things because probably you see yourself to be this small person at this particular corner, and that is something very big. No, be confident, dream, dream big, like dream big, and don't. And one thing I would also say is, aside being confident and dreaming big, be an intentional individual. Be intentional about whatever you find yourself doing. If you are in school at the moment and you are studying, study well. When the opportunities come, you make sure you grab them, like you apply for them and all that. Aside the opportunities coming, sometimes you have to go and look for the opportunities yourself because it depends on how intentional you want to be. What's your goal in the next 5 years? What's your goal later on? Do you want to be just a pharmacist or a medical doctor in your corner, in your vicinity? Or you want to make some bold inputs elsewhere? Because that is one of the things that would drive you from your comfort zone to a different space. If, for example, I'm in school and I didn't engage myself with IPSF related activities, and I'm just in my small corner, I'm in school, so that's what I came here to do, school. First of all, it will help you to even be the holistic professional we want to be in the future. So then here's the case. That's one of the things that would help you go there. You have to move from your comfort zone. Yeah, sometimes applications is not easy, like when you're applying for such things and you don't know will you get it or not. But first of all, put in your head that anything worth doing is worth doing well. If you find yourself even mopping, mop well and get that self-satisfaction you need to get after you are done with the good work done. So with respect to that's how I was able to, let me say, find myself in such spaces, is because I moved from my comfort zone. And one thing I'll say is after I moved or I started engaging myself in these health related activities such as the WHA, the WHS, it kind of serves as a motivation to others when they see you because, oh, this our person has been able to move there, then I can also do it. That alone, I didn't need to talk. I didn't need to go and tell them that, oh, do we have something like this? You have something like that? No. Just you moving there serves as a motivation to others watching because everybody's just watching and observing. But they just need someone to move. So then what I'll say is be confident, know your facts well, and anything you find yourself doing, do it well. Be intentional. That makes you exceptional. When you are intentional, you become exceptional to do what you find yourself doing. Then I think that's one of the things that can help you to move to such spaces. Okay, because WHA would not come and call or come and select you from your corner if you are not putting yourself out there. Okay, I mean it's possible for the other way to happen, but on a larger scale, unless you put yourself out there, unless you do what you are doing and do it well. As I said, you don't have to be doing the bigger things before you can feel that you're doing something. Even with the little things you are doing, if you are just a monitor in your class or something, do it well. When you do it well, you're able to build this kind of integrity and dignity with respect to your work. And anyone who sees your work can testify to others that this person does things well. And that alone, that kind of testimonial alone can take you to places and can help you to do what you have to do and do it well. Okay. So I think that's what I'll say to answer that question.
That's an amazing response, I think, and very excellent advice for students. It shows that preparation, confidence in your message, and persistence are the key for students to make an influence to make ways to these international societies. So thank you so much for that. What role do you think mentorship plays in shaping student leaders, and how can we create a strong support system for future leaders in global health?
Okay, so I'm going to answer the first part of the question, and Lisa, you reiterate the second part of the question about the mentorship. So when it comes to mentorship, let me give you a classical example when it comes to me. When I was in junior high school, the mentor I had is different from the mentor I have now. Why am I saying that? Every time and what you want to do or what you want to achieve and how you go about it. When I was in junior high school, my goal in junior high school was to pass my first national examination. So my mentor at that stage was someone who had passed it easily with flying colors. So then I was, sometimes one thing about mentorship is it depends. We have two aspects. Either you follow the person's steps, dito, or you do it your way, but you have a goal, which is the person to attain. I mean, not necessarily the person, but what the person probably did that made you interested in their work. So then when that happens, the person is always like mentoring you, guiding you on what you have to do, checking up on you and all that. Sometimes we need these basic checkups. Basic, are you doing your things? Are you doing what you plan to do? It helps you just to stay in line. Okay. So when I had that chance of a mentor who was always asking me, have I studied? Have I done this? Have I captured all this? Have I captured all that? It put me in my shoes to do what I have to do because I had to make sure I attained the goal. And God being so good, I did attain my goal because I was following them. We have to, as I said, we have two types. Either you follow the mentor, like what the mentor did. Remember, everybody's unique. So it's not all the time that can work for you. Another way is you do what you have to do, but you have the guide of the mentor always checking up and following up on you. So I chose the former. I was following the mentor's work dito, but I realized that no, the mentor was naturally a very good student. When I say very good, okay, let me not say very good, but like she was a different type of learner. She is that kind of learner that does not have to sit in class, uh, go. She doesn't have to go to her books and read and read and read the whole thing again and again and again. No, she's that kind of student. Sorry, some patients. That kind of student that just has to sit behind let the teacher teach, and she just grabs it there and then. But I realized that I was the one that would have to go back to my books and go over again, go over again, go over again. So I realized that no, following her exact steps, dito, also going to class and thinking that I am also like her and I can no. That's why you have to believe in yourself. So when I realized that no, I'm not that kind of learner, and I'm the one that has to go back to my books and learn and learn and learn and learn again, then I changed the way I was. As for the goal, I'll surely get the goal of passing my nationals. That's my first nationals, which was what she did that inspired me to let her be my mentor or her to mentor me. So because of that, I changed my method and I was learning like the way I knew that I would learn to be able to grasp what I'm supposed to grasp. When that happened, I was able to achieve it. When I got to high school, I had a different mentor. When I got to university, I got a different mentor. So then what I'll say is mentorship is really needed. I feel like we have to all have somebody that can hold us accountable for what we find ourselves doing. Because that's the only way that's one of the ways you can stay guided to achieve what you plan to achieve. Someone that can push you back into the line when you are falling out. Someone that can push you when you are falling down. Because it's only these people put in place that can guide you or help you stay put. Because I know we are humans. There's something in my language we say the body is not firewood. Okay. Anything can just burn. Body not be firewood. Like anything, the body is not firewood. Like so we can easily fall at some point, but we'd always need someone to help us. That's where mentorship comes in. As I said, we have different aspects of mentorship. I'm taking the part of accountability. Someone someone who would help you like stay put and do what you have to do. So sometimes when you're telling, always make sure you select a very good mentor. So when, for example, even your mom, your parents can serve as mentors or serve as accountable people that can help you. So you tell mommy, I have your parent or anyone, your guardian or anyone, I want to do this. Can you please? I mean, even sometimes when you just tell them, they get to know what you are planning to do. I want to do this. then they start to serve as like they hold you accountable. Have you done this? Have you done this? Have you done it? Have you achieved this goal, that goal to be able to attain this? It's all part of it. So mentorship is very important for we students. It helps us, it puts us in check. It helps us to know that we have somewhere to go or something to achieve. Okay. And the last part of the question is, Madina.
Yes, the last part of the question is, how can we create a stronger support system for future leaders in global health?
Okay, support system, stronger health system, support system. So how do we do that? We have to, first of all, know that no man is an island. Okay? No man is an island. We are social beings. Okay? Even if you don't connect with people, a lot of people in a broader sense, there's always someone or people that you can connect with, because no man is an island. Okay? So then, if that's the case, you have to be intentional about building or having a support system around you. There's always this one person or two that help us to do what we have to do. And all these people can fall under your support system. And one thing about support system is that they are helping you. I mean, if it's genuine and mutual, both of you are helping each other. It's like a therapeutic relationship. Therapeutic, like it's therapeutic. So a therapeutic relationship. Both of you are helping each other to achieve what you plan to, what you individually have set for yourselves. And that can help you at the end of the day. When it comes to health professionals like us, like we all, at the end of the day, we need our support system here becomes our fellow health professionals from different professions. This is where the nursing comes in, the doctors comes in, the dentist comes in, the physician assistant comes. Like we all these people, we have to see them as support systems and not competition. Because when you go to certain parts of the world, like when you come to Ghana, they see medical doctors sometimes as very important as a pharmacist. It doesn't mean that because that is the knowledge that is there, feed into it. No, be different. See them as collaborators. See them as other health professionals that can help you to provide that holistic patient care therapy to the patients you are catering for. For example, sometimes when you are dealing with the patient as a pharmacist, you realize that this patient needs social therapy, needs social prescriptions. So you connect this patient to dance groups. You connect this patient to, like, link worker models. This is something very common in the UK. Link worker models, where patients are connected to non-clinical services for them to be able to, interact with people, get to have a strong, get to socially be free, so that they can, health, sickness and disease is not just physical. Sometimes it's the mind. So then that's where social prescriptions come from. And pharmacists, we can help with social prescriptions by referring our patients to such non-clinical services. And these are different health professions that take over these things. So this is where you're supposed to develop a very strong therapeutic relationship with your other health professionals, and they can be your strong support system to achieve that one health for the patient. And remember, at the end of the day, it's public health. At the end of the day, it's global health, like for everybody. Because when we all start small from our various corner, that we see our other professionals as support systems, as friends of the race, and not as competitors. It helps us to achieve that global health we are trying to attain when everybody is doing that from different countries. Okay, so that's what I'll say about support systems and professionals.
That's, I think, way more beautiful than the actual question, I think, especially when you break down and answer the mentorship part individually. And as you mentioned, whenever you're having a mentor with yourself, he or she is just going to guide you. You have to find the way yourself, first of all, and figure out the way that you want to proceed. And also regarding developing healthy habits, where I think that's the most important point for students. And I really appreciate your perspectives on that. Thank you so much for sharing them all.
You're welcome.
Thank you so much. So, coming to the final reflection and summary of today's session. What a powerful session it has been. Thank you so much from Diana. Thank you so much from Josephine. And thank you so much from Marisa for sharing their incredible amazing point of views and answering the questions with lots of patience with us. And from all of them, we have heard about the importance of resilience, integration of science and leadership, and student voices in global policymaking. We also heard how to exchange programs, safe medicine advocacy, cultural diversity, and mentorship that all play vital roles in shaping student leadership. We also explored the bridge between innovation and equality, the need for skills in diplomacy and science, and the potential for students to lead the future of technology-driven healthcare. Together, these insights give us a very clear message about student leadership is not just about the future, it's already shaping healthcare today. And leadership is about service, collaboration, vision, and not just position. And besides all of these, the most important point was the next generation of leaders must balance science, innovation, and compassion to build a healthier, more equitable world. And I want to sincerely thanks once again from Diana, Josephine, and Marisa for their wisdom and inspiration, and our audience for engaging in this important discussion. And this was only the beginning. We will have amazing sessions ahead. But before that, and before we wrap up today's session, we would love to hear from you. And if you have any questions from our panelists, you can drop them in the chat box or you can raise your hands so we can catch up on those questions. And yes, we have 3 questions. First question is, which area of global health should youth focus on most in the next 10 years? And if Diana is there, and if she can answer this question.
Yeah, I can definitely answer that question for you. I just can't see it. Can you, wait, where does it go?
Let me repeat it once again.
Thank you.
In your opinion, which areas of global health should youth focus on most in the next 10 years?
Ooh, next 10 years. Well, my answer is going to be very easy. AMR, because it used to be back in the day, every region of the world had their multi-drug resistant bacterium. And now, because over time people migrate, people live and they travel, now we're seeing a plethora of spread of these multi-drug resistant bacterium. I know the US used to only have 1, now we have 4. Really bad areas are unfortunately going to be Afro and Asia Pacific, just because of the region and the climate that they are in. It does give it a better option. I definitely think fungus is going to be a major conversation in the next, not 10 years, 5 years, because we only have 4 drugs. Yes, I did say that. 4 drugs that can combat fungal infections, especially for patients with HIV who are very easily susceptible to that. And same with oncology patients are very susceptible. But even in the US, we're finding research of individuals who have a good immune system and between 25 and 35 who are getting fungal anomas in their lungs from aspergillosis, which is very uncommon, especially in colder climates. So I heavily would say research, heavy antibiotic, heavy antifungal research is going to be a very, very, very important in the next 10 years, because we need new drugs. We need things that can combat these new developments, but also having awareness around these topics so that we can, as pharmacists, educate our populations and our communities heavily, even if it's on social media or just in person, because that's going to be the game changer, is getting more health literacy and more education out on these topics.
That's, I think, a very perfect answer. Thank you so much for sharing that. So the next question is, how can we join WHO Youth Council, as well as can you tell your experience about your time representing youth at global level? So Josephine, do you want to answer this question?
When it comes to the WHO Youth Council, I believe Marisa will be the best person to answer this. Marisa, are you there?
Yeah, I am. So I was typing in the chat box as well. So regarding to join the Youth Council, you can enter international organization. For example, in IPSF. I'm not sure if you're still hearing me yet. So basically in IPSF, we have like a position of public health chairperson, and the public health chairperson is the liaison to IPSF and the WHO. So basically, either you can enter international organization and pharmacy or medical field, or have always a look on the WHO website, because they daily post internship opportunities for youth. Or, for example, United Nations as well careers, not only just in WHO, but technically in WHO, you need to see the WHO website and always have a look and shoot your shot. Like give your CV, write the letter of interest, and you never know, you might be selected to join the council.
That's amazing. Thank you so much, Marisa, for your answer. And the last question, what essential skills should students develop now if they want to work with international organizations like WHO? And thanks to Marisa, she has already answered that in chat box. And the answer is build connection, lots of connections, and be engaged with international events, whether online or offline. So thank you so much, everybody, for joining us. And lastly, before we close completely, I want to kindly remind all of you, fill out the feedback form. Your feedback is very valuable for us. And once submitting, you will receive your official certificate of participation within 7 working days via your email. And lastly, on behalf of SCRMP International, thank you so much for joining the global premiere of Student Leadership for Healthier World. And a special thank to our amazing panelists, Diana, Josephine, and Marisa, for sharing their inspiring journey with us. This is only the beginning. Let's continue to lead, connect, and innovate together. Take care, stay safe, and see you at the next SCRMP events, especially at the symposium on October. Thank you so much, everybody.
Thank you.
Thank you. Goodbye.
Bye. Thank you too.
Thank you. Goodbye.
Together we rise, passion and pride, learning, healing side by side.